Hi everyone. We are Group 1 and we will be going to share our learnings regarding the core values of nursing in conducting health assessment. Objectives. Core values of nursing. A competent nursing school instills in its students core values that will carry us into our future careers. In pursuing a nursing degree, here are some of the core values of nursing that we think are fundamental to our nursing education.
Applied therapeutics. A nurse applies medically ordered therapeutic modalities like pharmacological and nutritional interventions and etc. A nurse's application of these modalities is based on a knowledge base regarding their therapeutic uses as well as skills in patient assessment and evaluation. The competent application of nutritional knowledge also involves its use in health and wellness as well as when therapeutic diets are prescribed. So, applied therapeutics is one of the core values of a nurse in which a nurse should be skilled enough to apply therapeutic modalities that are fit to the patient. It is important for us as a nurse to gain knowledge about the therapeutic effect and toxic effect of a certain drugs or modalities that we are tend to give to our patient. As we know of this, we will avoid unwanted situation and the patient will also feel confident and comfortable thus.
Observing ethical and legal considerations. A nurse plans, provides and evaluates nursing care guided by specific ethical and legal boundaries. Code of Ethics for Nurses provides the ideal framework for safe and correct practices and behavior. Ethical behavior also involves accountability, responsibility, confidentiality, truthfulness, fidelity, and justice. Accountability requires nurses to follow an ethical conduct code based in the principles of fidelity and respect for the dignity, worth, and self-determination of patients. Responsibility. Responsibility, deti responsibilidad mo as a nurse nga mangi-provide iti care kay patients mo as well as their families or associated groups. Confidentiality, maintain privacy. Tapno mapigilan ken maiwasan iti pinagi-share iti personal nga information without your patient's permission nga iwaras or ipadamag mo no anyaman iti napagsaritaan nyo. Truthfulness. No met deto iti pagsasaritaan kit, dapat agiba ka ti osisto kadigita patients mo kasi iso ti mesang importante ti agibaga nga osisto. Kasunod da kano ko agarod pagkatiwalaan iti patients mo no kuano haan mo met isuda nga hamumet ibaga ti osisto kinyada no kwa. Fidelity is keeping one's promise. Dapat si ka-underskate maging tapat ken totoo deta pangako ken responsibilidad nga provide iting nangato a kalidad. Ligtas nga panagaywan in a competent manner. And justice, being impartial and fair. Dito ket iso iti obligasyon mo nga maging fair iti amin nga patient mo wenno sa baliman nga tattao. Next ate.
Nurses who clarify their values and enhancing their ability to practice ethically. This means that as a nurse, we should know to balance our actions towards our patients so that we will not have any problems in the future. We need to act accordingly. Legal parameters of nursing are defined by statutory, regulatory, and common law. Statutory law or written law made by the government of a country. This is either civil or criminal. Civil law protects the right of an individual within our society and provide for fair and equitable treatment when civil wrongs or violations occur. Regulatory law involves creating and managing the rules and regulations created by federal and state agencies. The ticket take as na rules and regulations naramid time sa hospital or the Department of Health. These are careers in regulatory law inside and outside of the government in everything from finance to environmental law. Common law, also known as unwritten law. It influences the decision-making process in unusual cases where the outcome cannot be determined based on existing statutes or written rules of law. It draws from institutionalized opinions and interpretations from judicial authorities and public juries. In addition, next ate. Next ate. In addition, professional standards of care provide the legal guidelines for nursing practice. Legal considerations in the care of clients involve issues like negligence, malpractice, abandonment, assault, battery, and informed consent. Nurses must understand the legal boundaries to protect their patients and their own rights. The overall point of view in this part is nurses should abide the legal guidelines in nursing practice. They need to be careful when providing care for their patients. And mas example na that, we get negligence. Negligence is a failure to take proper care no mo na administer ti gusto ang medications ni patient mo, and because ka deta ag suffer isuna and agka complications or the worst is matay. Also nurse should set their boundaries from nurse to patient relationship only.
Ken data ket importante ka dagiti nurses nga six iti legal concepts kasi dagiti nurses ket accountable da ka DJ professional judgments ken actions dan ko.
Professionalism involves the characteristics of a nurse that reflects his or her professional status. These characteristics involve behaviors with regard to self, patient, others, and the public as they reflect the values of the nursing profession. Professionals are knowledgeable in their subject matter, conscientious in their actions, and responsible for themselves and others. Written standards for practice and professional performance guide the behavior of professional practitioners. We believe nurses enhance their professionalism by understanding history, educational choice, professional research, and jury, and their professional organization and standards. So professionalism is commonly understood as an individual's adherence to a set of standards, code of conduct, or collection of qualities that characterize an accepted practice within a particular area of activity. So example is in engagement. So actively contributing to conversation, decision making, strategy, and work in line with expectation of your role. And so in time management, so reasonable use of time. For example, playing video games at work isn't typically considered professional. Uh, Another one is how to be competent. To know how talent and fundamental knowledge required for a role. For example, a software developer with a solid grasp of first principle of computing, example design. So another one is hygiene. Maintaining a reasonable professional appearance and level of personal hygiene. So that's professionalism. Next.
Make the care of people your first concern, treating them as individuals and respecting their dignity. Make care your concern first. Listen to the views of others instead of dodgily following your own path. Offer information and advice in a simple way so that people can make decisions about their own care. Do not accept gifts that you might think can be interpreted as an attempt to gain preferential treatment. Recognize that every patient is different and will have unique needs. Respect that everyone, nurses, and colleagues have different cultural values and beliefs too. Do not assume you know what someone needs or what someone will want by the way they look. When referring to patient care studies in your coursework or anything that may identify an individual, be sure to change the names or make them anonymous. Do not give out information to someone who isn't entitled to it. And if you're not sure, ask your supervisor. It simply means that it will help us to focus all in our decision on what matters the most. Make your patients your priority, such as assisting them, giving support or advice, and their personal needs, such as showering, dressing, and eating. Providing privacy is a must. Also, we should give them a quality care. Giving quality care will help them to recover faster and it will improve their mental and physical health because we have already gained their trust. Moreover, we should give them respect, treating everyone equally, including healthcare workers. For instance, when they are not satisfied with your care and when they ask favors, then every patient is unique. You won't know their needs by just seeing them. So assess, give attention to their needs, and make sure that those needs are met.
Try to cooperate with members and respect their individual contributions to your education. Treat everyone you work with the same amount of respect and let your mentor know if you believe you or someone else is putting someone at risk of harm. Next, ate.
Provide high standards of practice and care at all times. Ask for help when you need it and recognize when you're out of your depth. It's not going to look bad if you admit that you need more guidance and attend your shifts and be punctual. It simply means that asking for help or guidance from others does not make someone look weak or stupid. In fact, asking for help is just another way to show how willing you are to learn and be a better one, to improve yourself. Kasi um, um, needs of the patient needs immediate action due to the fact that health is what we are talking about in here. Health, di ba, punada nga ron, health is wealth. So nga dapat ma-attendan immediately day haan nga dapat nga damdaman ton kasi dapat sigud-sigud nga dapat on time dapat kanayon. Next.
Be open and honest, act with integrity, and uphold the reputation of your profession. Do not plagiarize coursework or clinical assessments. Complete a truthful and accurate CV. Inform your university if you're cautioned, charged, or found guilty of a criminal offense. Follow your clinical reputation of your profession. Follow your clinical placement dress code. Be aware that how you act outside of your placement in your spare time also impacts on your perceived ability to practice. Honesty is a critical to continuous development and maintaining mutual trust, which is a prerequisite for a high functioning team and to help recognize and avert failures regardless of where they are in the hierarchy. We need to be accurate in every data we gather from our patients and likewise in our nursing actions and be professional in dealing with our patient not only in our interventions but also in the way we interact with them and how we dress up. Furthermore, if any case na we think na ada error ng obra, we should always be honest to avoid a bigger problem and face the consequences no matter what.
If you are not sure, ask. Double check always. You need to protect someone from harm or if someone has indicated that they're unhappy about their treatment or care. Double check your treatment is ensuring that you did the procedure right. Nothing will go wrong if you follow the procedure. Just be sure that it is the right treatment. You need to protect someone. Always ask patient after treatment to ask if there's any discomfort feelings like when a patient with open wounds that you treated. You should you should ask them if there's any discomfort or pain in that area. Also, asking question is important to protect someone's right and safety. For example, a visitor claims that he will discharge a patient of yours, asking question regarding the patient and requiring them to provide proof will make sure that the patient is safe. Asking them questions will benefit you in terms of experience and performance. Next, ate.
And that ends our discussion. Thank you for listening.